Today I will be talking about side effects of steroid creams and ointments. There are many conditions for which you may need to apply steroid medication on the skin, but sometimes, especially if not used properly, it can cause some issues. For the first time viewers on my channel, I am Dr. Shukla. I am a dermatologist. The first side effect I want to tell you about is probably the most common side effect. It's called skin atrophy, in which the skin becomes thin and shiny. When the skin is thinned out, it becomes wrinkled and lighter in color. The underlying tiny blood vessels become visible and look like spiders. Skin atrophy may take months or years to resolve, so this is something you absolutely want to avoid. Now, let's say if you have a condition that will require you to use steroid cream for a long time, for example, eczema, psoriasis, etc. Steroids are almost essential part of treatment in these conditions. So the best recommendation I could give you in such situation is that you must visit your dermatologist regularly and frequently for proper follow-up. That way, depending on your disease or response, your dermatologist can either decrease the steroid strength or stop it. However, if disease process is such that you cannot stop or decrease treatment, then in some cases, your dermatologist may switch the treatment to other alternatives. Another common side effect of steroids is stretch marks. They develop after a prolonged use of steroids at any place, but are more common at the friction sites like armpit and groins. A big issue with the stretch marks is that they are permanent and they cannot be reversed back. Before I go to another side effect, let me first say this. All these side effects I am telling you about may sound quite scary, but the important thing is that these occur when the steroids are used without regular follow-up or used without prescriptions. If you use them under medical supervision, steroids are extremely useful in treating some of the very stubborn skin conditions. The next common side effect of topical steroids is skin infections. This could be bacterial, viral or fungal infections. This happens because steroids decrease the local immunity of the skin. So here I am talking about the skin's ability to fight infection at the local site where the cream has been applied. I am not talking about the whole body immunity here. Fungal infections are very common and a big problem. Let's say if someone has athlete's foot or any other skin fungal infection. Many times they are wrongly diagnosed as some form of dermatitis and steroid creams are prescribed. Initially, you may feel some improvement because the steroid will take care of the inflammation, the redness, itching, etc. But it's not going to kill the fungus. In fact, fungus will now grow more because of the decrease in local immunity. So after some time, the fungal disease may flare up, even worse than it initially was. Due to this issue, there has been a sharp uprise of fungal infections of skin, especially in countries like India, where medications can be obtained without prescriptions and are often misused without doctor's supervision. Sometimes the antifungal creams may also have steroids added, which again may cause similar issue of rebound flare-up of infections later. I have to mention this here that in some cases of fungal infections, topical steroids may be prescribed by a dermatologist along with antifungal treatment if he or she thinks that the inflammation is really severe and out of proportion to the infection. So in such a situation, it's okay to do it in the best interest of the patients. But please never try it yourself. Never try to use the combination creams, combinations of steroid and antifungal cream by yourself, as it can lead to a bigger flare-up of the fungal infection. Let's come to some other problematic side effect of topical steroid. One of these problems is rosacea. Rosacea is a condition where you may have redness on the face, especially around the cheeks and the nose. Steroids on face may also cause pimples on the forehead. We call it steroid acne. Topical steroids may cause redness and burning sensation on the face and sensitivity to sunlight, which we call photosensitivity. Next side effect is especially more of a problem in women, and that is excessive facial hair growth. Other effects of long-term steroid use can be discoloration of the skin may become pale in that area, or there may be bruising and some red spots. Now in general, any side effect of steroid depends on the type of steroids and for how long it is used. If the steroid is of medium or high strength and are used for a long time, it can have severe side effects. In India and some other countries, steroids are freely available without any prescription, and many people go to chemists asking some ointment for their skin problems, and the chemist give them steroids. Since they feel better with these creams, they go on using it for a long time without knowing that it can cause serious side effects. The most important thing is that never treat yourself. When prescribed by your dermatologist, then follow the exact instruction and also have regular appointments with him. Another very important point is that it should be applied only on the affected area and not on the adjoining normal skin. Otherwise, the adjoining skin will become pale and thinned out. It should never be used for more than the prescribed time. You must take care of using steroids properly in children and also in the body areas where the skin is more thin or delicate. This is all for today. Let me know in comments if you have any questions. Also, you may mention any other skin condition you would like to know about. See you soon with a new topic next time. Thank you very much for watching the video.